name's Christy Sternbach-Weiss. I am one of the co-founders of the Canine Collaborative, which is a group of people we're trying to organize eventually to have an indoor dog training place, dog training, education, place to play if you have a supervised trainer there, have groups there, all different aspects of things that to do with dogs. Not a dog park. Just want to make sure that it would not be an indoor dog park. But given that, we just want to sort of welcome everybody. What we're trying to do at this point is just to give a lot of presentations, education, and we're very, very fortunate to have Dr. Joe from Montpelier Veterinary Group with us too. I can answer any questions about anybody with a name tag like this can answer questions about the Canine Collaborative, and Dave, you have to give yours up. And the other thing is, this is also being filmed by Orca, so you'll be able to see this on their station. The other thing is
ours.
And ours, yeah. Oh, we're gonna put on ours too. Okay.
Yeah,
Takes a couple weeks, I think, right?
Yeah.
It takes a couple weeks. And the other thing is, because we're doing things regarding first aid and health at this point, we've been, CB Dart is here, which is Central Vermont Disaster Animal Response Team. And Cindy Drinkwin is one of the representatives. She's gonna come up and tell you a little bit about what they do.
So I'm from VDART, and we are the Central Vermont part. There are different ones all over the state, so if you're from elsewhere, sorry, if you're from elsewhere, there are other chapters, I guess. And what we do is we help animals during emergencies. So if there were to be a flood or a fire or some other disaster, we would open up a shelter area and people could bring their animals to us, or if it was a horse or something that we couldn't take in, they could come to us for advice about what to do. And we would care for that animal while the people were unable to. So we were open for about a month during the July 2023 flood. That was our longest deployment. That's a funny word. So that was our biggest example. We've been open a few other times for smaller things. And we're also trying to get towns organized to have their own shelters. We can't, in a huge flood, get everywhere. So anyway, that's what we do. I'm not going to take any more time.
Oh, no, you
And,
take so much time as you need.
we've got a table back there with lots of information. We love volunteers. If that sounds like something you're interested in, we have monthly trainings on how to take care of the animals, how to take care of the people. And that's that.
I'm Dave Ryan. I'm with the Canine Collaborative on the board there. I'm here to introduce Dr. Neil Turley. He's with the Onion River Animal Hospital. Montpelier Veterinary Hospital. Onion River was the last time, sorry. Dr. Nick is from Morrisville. He's from a long line of vets. His grandfather and great-grandfather were both veterinarians. He's a graduate of Purdue. I personally bring my dog here. I think he does great. Enjoy.
Yeah, thanks. Oh, thanks very much for that warm welcome. And Onion River, great company to have. So we work very well with other hospitals around, and they're excellent too. I just put up a slide here just to kind of recognize our beautiful library. Very lucky to have that in town. My wife and I live in Middlesex, and our kids come down here. It's my father on the left and my son Jack and daughter Lucy for a day of reading or being read to, I should say, at the library. But yes, thanks so much for having me.
If you don't mind speaking up just a little bit.
Sure.
I appreciate it. Thank you.
Sure, I'll do my best.
Thank you.
So, getting right into, I have a couple things we'll go through with this talk. We'll start with winter safety tips, and good timing on that with the cold front. Are most at risk, I kind of broke things down into animals that are most at risk. Small size dogs, not as a hard and fast rule, but a lot of times those smaller dogs are going to be more prone to getting cold faster. There are exceptions to that. My parents had a little fuzzy Pomeranian that would be perfectly content out in the snowbank for most of the day, but as a general rule, the smaller guys are ones we're a little bit more concerned about getting cold earlier. Puppies, puppies have limited body fat store, so those guys also are going to be more prone to cold. Short and thinly coated breeds as well. Your Chinese crested is going to likely get cold faster than your Malamute. Underweight animals, we'll go through more of kind of like the sick guys later on in the presentation, but older animals and animals with medical conditions as well as being more at risk. I put this bullet point 5 on because we do see a lot of dogs that have come up from rescues, from warmer parts of the country, whether they've moved here or come up through a rescue. So a lot of times those guys are not acclimated yet to our winters and whatnot, so they're going to be more prone to getting cold as well. When I was kind of looking up articles and researching for this, I came across a good quote from doctor at Illinois. Just say, there's no straightforward answer as to how cold is too cold and how long is too long to remain outside, because there are a lot of variables. So that's there's definitely a lot of different things we think about with the weather. Signs that your dog may be too cold. All of these, individually, may not be an indication, but whining or barking. A lot of times dogs when they're outside, will do that if they're getting too cold. You'll see them kind of limping or lifting the paw off the ground. Certainly when we get into these really, really cold days, the negatives, you'll kind of see them retracting the leg, limping, due to that cold. Reluctance to walk. If it's a dog that's normally running about and all of a sudden they're putting on the brakes, it's a potential sign. We can see them doing some tail tucking or kind of being in a hunch position as well. And then of course, shivering. We'll see them do that too. This is just a fun little chart, going kind of over that, those signs up there. So hypothermia, that's something, of course, you see with humans. We can see that in dogs as well. Risk factors for that, obviously the cold. In a practice setting for us, we're also worried about it for general anesthesia, keeping dogs warm during surgery. Again, our more prone groups are going to be our neonates, our older dogs, animals with cardiac disease, and hypothyroidism as well. This is right out of a textbook, kind of broken down. Mild hypothermia, starting 99.5 and below to 90. Moderate hypothermia, 82 to 90, and then severe hypothermia under 82. This is a chart that I took offline. VEG, it's a corporate emergency practice. This chart I think is a good basis for temperature. It's definitely not the be-all end-all, but I think it does do a good job of giving kind of broad recommendations. You get into these below 20 degrees, below 0 degrees, limiting that time outside to potty breaks or going to the bathroom and then back in. Closer you get to 20, I think the kind of the longer those bathroom breaks can be. But really, when we're in the below zeros, be trying to go out, go to the bathroom and then come back in, not spending a ton of time out there. Getting up into closer to freezing, that's when you do start to kind of look at the size of the dog and their ability to tolerate the cold. So I'd say really 32 to 45 for most, and this is where I disagree a little bit with the chart. 32 to 45, I think they're generally safe outside, but definitely keeping in mind those senior dogs and smaller dogs, as you get closer down to the 32s. But I think overall, good guideline. So physical exam findings of hypothermia are things that you would see. Shivering, weakness, when they get really, really cold, too cold, we'll actually see them start to develop some neurologic signs, ataxia being like kind of that walking drunk, where they're wobbly in the back end or sometimes front end. Obviously severely cold, we can see them go, coma. I will say, fortunately, we don't see a lot of these guys because our owners are usually very diligent in keeping track of their dogs this time of year. But nonetheless, with hypothermia, when we are kind of in that mild hypothermia, we'll start to see them have an increase in respiratory rate as well as a heart rate. But as we get into that, really much colder, we'll actually start to see their heart rate decrease and respiratory rate decrease as well. So kind of, I think it's a good thing when your dog's at rest to just kind of get a normal of what their normal respiratory looks like and their normal, what their heart rate normally is. And that can vary within size and whatnot of the dog. But I think getting a good normal before you're trying to make a judgment call is a good thing. As far as rewarming goes, for that mild to moderate hypothermia, we do like a passive external rewarming where we're wrapping the dogs up in blankets or bubble wrap or foil to really retain that heat. As we are getting into those more extreme cases of hypothermia, we'll actually put do some active rewarming with like a bear hugger, which is it's like a blanket that has hot air pushed into it. You can use heating pads as well. You do have to be careful with heating pads because you can burn the dogs if left on too long or too high. Warm water bags as well, and of course an incubator. But in our setting, in a clinic setting, a lot of times we'll use that bear hugger. At the clinic, but at home, bubble wrap, blankets work well. Frostbite. Can dogs get frostbite? Absolutely. The predisposition for that, again, are going to be like those hairless or short-haired breeds of dogs and cats. It can really vary. We see a wide spectrum of frostbite. We can see those mild cases going undetected, where we really don't see much, and we can see anything from that to where the actual limb is frozen. And again, those cases usually are something where the dog's been hit by a car or something like that, where they've been left in outside for a long period of time, gotten really, really cold. But again, a very wide spectrum. All right, so the areas that are going to be most prone on the dog are going to be the ears, the ear tips, the tail tips, and paws. Can be hard to detect initially. A lot of times the extent of the damage you're not going to see for a while after. The area oftentimes is cold to the touch. Usually we'll see that area initially be turning white or gray in color, and then a lot of times developing kind of this waxy appearance, and then can be painful upon rewarming. As the affected area thaws, the tissue may become red or blister, become swollen. Days after the frostbite occurs, that tissue may become shrunken, discolored, and then we can see sloughing of that tissue, up to weeks after, after that exposure. This is probably too much in depth for this discussion, but I always kind of like to have the why. So how it happens is we'll actually see the cold causing vasoconstriction, so constriction of those vessels and damage to the lining of the blood vessel, and actually getting some thrombosis in there. And we'll have basically a lack of nutrient and direct cellular damage to that tissue. And when that tissue freezes, it'll actually pull fluid out from within the cell and cause electrolyte changes and protein change within that cell. So treatment, similar to the hypothermia, and that's a lot, in frostbite cases, that's the most important thing, is if they are hypothermic, we treat that first. So we try and move them into a warm, dry area as fast as we can. Treat the hypothermia first by doing the wrapping of the blankets or water bottles. Try not to rub or massage the affected area. It can do more damage in doing that. And also trying to, if you're going to start warming that area, try and be in a spot where it's not going to warm and then refreeze, because that in itself can cause more damage as well. And then not applying like a direct heat, like a heating pad, on that affected area. As far as what you can do like a warm water, either on a towel or putting the digit or what have you in warm water to help warm that tissue up gradually. If it's too hot, obviously you can do damage, but a nice warm water will help bring that start to warm that area up. Once you're done, you can pat that area dry, get it as dry as you can. I have apply a bandage on here as well. I mean, really, if we're seeing tissue damage, probably should have that looked at by your veterinarian. But if there is damage there, you can put a non-compressive bandage over the wound. Paw Patrol. So this is the time of year we do see snowballs starting to get in between the pads and digits. So checking for that, certainly after a walk. Checking for cracks and cuts from the salt and ice. This is definitely a time of year we start to see that. We'll touch more on this later in the PowerPoint, but wiping or washing the paws after returning outside and coming inside to get some of that salt and de-icers off. As far as preventative measures, wearing booties is great. I know my dogs will not tolerate booties. I'm sure, and when I talk to clients, some dogs don't mind it at all and will wear them, no problem. Others will seize up and not move or tear it up and chew it off. But they work very well, and I will say, in the years I've been out in practice, we have more models than we used to. I think probably more, some of them are a lot more comfortable than they used to be. So there's a lot of selection, for those now. As far as a topical putting on, petroleum jelly is something you can definitely do. Putting that on the pad before you go out. Mushroom Secret's a really popular one. We have no affiliation with that product, but I know a lot of our clients use that and have had really good success with it. So that's a very, very popular one. The most of these are pretty similar. I would say Mushroom Secret more as, I think it's a little bit more repellent than probably the Bag Balm is. So the Bag Balm and the Paw Balm, which is another topical, I think those probably more used for like a treatment after a crack or after some damage to the pad. The Mushroom Secret has, I think, a little bit more repelling property to it, but somebody had written in, I think you guys had sent me some questions. I don't know of a marketed one for putting on the paw pad that I've had toxicity with as far as them licking it off. So these generally are quite safe, and I've never had an issue with anything gastrointestinal wise with the various topical products. But these are typically food grade waxes and oils, usually having vitamin E in there, semi-permeable so that they do allow some perspiration as well, and cause a nice barrier for when you go out in the snow. Has anybody had experience with Mushroom Secret? Use it? Good? Yeah. It's okay. What's that, sorry? Not so good? More kind of things to think about in the wintertime. The salt and other deicers, again, potentially causing irritation to the pads, irritation of the mouth and digestive tract. I don't have a lot on ethylene glycol. That is one we really don't mess around with. At home, that's one if you know of an exposure, should really be getting them into the clinic. There's not much room for error with that. So if you know of a spill, get the spill cleaned up, and then down to the clinic. That is one that you can see any time of year, of course, but in the wintertime, it certainly should be on the list to look out for. And again, when returning from outside, kind of wiping off the paws, legs, and belly to get some of that stuff off when returning from outside. The ice melts. The ice melting products are usually made up of some sort of salt, containing magnesium or potassium, calcium or sodium. Rock salt, here referred to as rock salt. Again, that can be irritating to the paws, nose, eye, and mouth. We can see gastrointestinal issues with that, whether it be vomiting or diarrhea. Sometimes we'll see it severe enough to cause dehydration or some neurologic issues like tremors and seizures. They have to eat a lot of that. We don't see too many of those cases pertaining to the ice melts. Usually when we see an issue, it's more like the irritation between the pads or minor irritation in the mouth or GI issues. We don't really see much in the way of dogs having gone out and gobbled down a lot of it to cause a seizure or tremors, but the risk is there. And again, a lot of it is like how much they eat. There are pet-friendly ice melting products out there. Some of the more popular ones, the Safe Paw, the Morton version of that as well. There's supposed to be less irritation to the stomach with that. Typically these are urea as their main ingredient. Typically those are considered more of the safe ice melts. I will say, I think all of them probably pose some level of risk if they eat a lot of them, a lot of it. But again, these are I think good ones to keep in mind. So as far as some strategies for winter, along with the booties, jackets for the older guys or smaller breeds, dogs with the shorter coats, try and reduce the amount of snowballs they're picking up, but either between the pads or on the chest, trying to get those off, and then just being cognizant of the amount of time they're out, outside in the cold. Other things to keep in mind, like the summertime, I would encourage you to not leave them out in an unattended vehicle. We don't see the cold dropping the temperature like we do when it's warm, increasing the temperature, but it's still, there is metal in the car, obviously, so we can see temperatures dropping. So just being careful about leaving them in the vehicle too long. Avoiding walking on frozen bodies of water. Not very often, but I will say we have had cases where some of the ponds with the aerating devices, where even in the middle of winter the ice isn't as thick as it should be, and have had dogs go through. A neighbor growing up lost a dog because they went out on the pond and crashed through. So kind of watching for that. Know a lot of folks go ice fishing and whatnot. If there's good solid ice, that. Great, but definitely keeping in mind traveling over frozen bodies of water. As far as identification, things like microchips or tags work very well. The microchip I like because they can't physically lose that. That's attached to your personal information. So if in the middle of winter your dog does get loose or have lost track of, the identification is nice. That way, if it's a neighbor or whatnot, they can see who the dog belongs to and get them back to you. Reflective gear or flashlight. Very dark time of year now, where after work or early in the evening we're in darkness. So definitely, if you're on the road, encourage having a vest with some sort of reflective gear. I always get worried when I see people in dark sweatshirt and no sort of reflecting clothing on when I'm driving. As far as walking and whatnot, controlling the dog, front clipping harnesses I think work well. I am a big fan of the gentle leader. Those again, kind of like with the booties. Some dogs, it's really hard to train to tolerate that, but overall I think they work very well as far as control goes. Not much stress on them when you're have to lead them, and it's much safer as far as they're not usually going to get a head of steam and pull you with that when the conditions are icy and whatnot. Which the retractable leashes, I'd also be careful with this time of year, where they can potentially get a good head of steam when you're on slippery ground. So be careful with the retractable leashes. Kind of back to that chart from the emergency clinic, walks up to half an hour if above freezing. I'd limit walks to 5-10 minutes when it's below that 20 degrees mark. More for our cat friends probably than our dogs, but this time of year when it is cold, just checking your car before you start it up. Cats will sometimes crawl up underneath, seeking heat this time of year. So just checking that, even if it's a quick check, just to make sure nobody's in there sleeping and going to get a nasty surprise. Other things I just have on here, using heat sources safely, not just for your pet, but for you as well. Like the little heaters, the electric heaters. Just be cautious about, if it's close to the dog bed, cautious about burning or the fire risk as well for those. Kind of back to the ethylene glycol, just I would limit the snow eating as well. That can hide some hazardous substances in there. So, trying to limit that if you can. This is the time of year too where if you have water outside, just make sure it's not frozen. They're having access to that, access to that water. Folks with livestock or horses, probably know that all too well right now with as cold as it's been, breaking up water dishes and whatnot. Provide good warm bedding for the dog. If you're in a garage or something like that, a nice warm, padded bedding. As far as dogs that are outside or do live outside, hunting dogs or dogs in kennels, I'd say that the biggest thing to think about is making sure they have a insulated shelter that they can go into, and then one that's also elevated off the ground so that they're, the heat isn't being pulled from them. And then lastly, just making sure that we're providing, if we are spending a lot of time outside in the cold, adequate nutrition, so that they have the energy sources for running around outside in the cold to maintain body heat. Other things to be cognizant about, the geriatric dogs, mobility is a lot of times an issue with these guys, whether it's from arthritis, where you're getting some pain from ambulating, from walking, or neurologic, where they're having trouble placing their feet. This is the hardest time of year on those guys. As far as walking without slipping, their footing. So making sure their little paths are shoveled. They're void of ice, so you're getting some traction down there from them. And using, like I was saying, using the well-fitting booties. There are a couple products that you can put on. It's like a sticky that goes on the bottom of the pad. Work well too. And this, like I said, this is definitely our toughest time for those guys when they're getting outside and slipping and falling and whatnot. For our older or geriatric dogs. This is where you guys come in. Indoor activities for dogs. I think the laser pointers, can get you some activity, buy you some time, hide and seek with your dog, indoor doggy daycare, the obstacle course. I think those are all great things to do. There are a lot, again, kind of like with the booties, there are a lot more toys and whatnot available online and in the shops. So you can get the treat dispensing balls and puzzles and toys and whatnot. Yes, sure.
A dog that got stereotypic behavior from a laser pointer. Dogs can become obsessed. As cats don't, but dogs.
Yeah, you have to be a little bit careful. We're going to go into a different topic off the winter stuff, but any questions off of this? Yes.
What's the normal temperature for a dog, body temperature?
Normal, if you look in a textbook, up to 102.5. So anything over 102.5 is a fever. Anything under like 99.5, I would say you're starting to get hypothermic. Yeah, 99. Yeah. Yes.
I've hiked for years with my dogs in the winter.
Yeah.
Temperatures below 20.
Yeah.
I've never seen any.
Yeah. That's where there's no, like I said, that's a very broad chart. I mean, you think of dogs running the Iditarod, they're going across, snow and ice for hours. So yes, that's why I put that first quote up there, is there's no, this temperature you have to stay in, there's so much variation within dogs and, their comfort level, and what they've been exposed to in the past, how they're acclimated. So, but people skinning with their, skiing and it's you have to. It's definitely a judgment call, but just knowing some of the risks. Yeah. Yeah.
So it looks like a lot of these things we can do at home, which is kind of the whole purpose of our.
Yeah.
At what point would you say with the cold, how long would you say this, like, oh, I gotta get this dog to the vet now?
As far as like, I'm sorry.
So if you've done what you can to help the dog.
Yeah.
How long do you give it to say like, oh, this is beyond what I can do now?
Yeah, I think if you are, I didn't have this, I mean, one thing that's good to have at home is a digital thermometer where you can take a rectal, temperature. We have folks do that most it's the other end of the spectrum for, if we're worried about a fever. But I think if you're, taking a temperature and it's under, that 99, if you're like 98, 97 for, 10, 15 minutes, I think it probably would be, or seeing a lot of these other signs, so I would say as far as like how long to wait, 10, 20 minutes or so. Yeah, I think that would be, and again, that depends, I think, on the severity. Like if they've been something else where they've been stuck outside for a long time, you're seeing them having trouble ambulating, seeing some of the more severe like neurologic stuff, then I would just be going straight. But if it's, you're thinking they're acting otherwise normal, maybe a little bit cold, I think like waiting like 20 minutes to try and wrap them up with a blanket or what have you is, we'll give you enough time to know if they're going to respond or whatnot. Yes. And everybody, this is Jen, our lovely receptionist. So I want to recognize her.
So just one thing I want to say to go with this.
Yeah.
If you're concerned about anything, call us.
Mm-hmm.
We are more than happy to touch
Yeah.
base with the doctor if you're concerned about anything, not just winter stuff.
Yeah.
So
Yeah.
you offer emergency care too, right?
We do,
Yeah.
yeah.
Monthly or veterinary?
Yeah, they have somebody on call
Yeah.
24 hours,
Yeah.
7 days a week.
Do you
We-
keep dogs overnight?
We, depending on the case, we don't, sometimes we still will refer folks to BEVs. We have an answering line where at least we can usually talk to our clients, and then either determine whether we come down and meet you at the clinic or, or send you on to the 24th, up to Burlington, up to BEVs, or Saves, Yes. Yeah.
I just moved up from Connecticut.
Sure.
In Connecticut, 20 degrees is 20 degrees.
Yeah.
Up here, I keep seeing 20.
Yeah.
It feels like.
Yeah. I know. Yeah.
And then when somebody
Yeah.
was saying about 20
Yeah.
degrees.
Yeah.
And I've seen my dog with paws.
Yeah.
And it's,
Mm.
I'm just like,
Yeah.
nervous and trying
Yeah.
to do the right thing. And
Yeah,
not take
sure.
her too far.
Yeah.
So when you say 20 degrees.
Mhm. Yeah.
Do you really mean 20?
Yeah.
It feels like 20.
Yeah. Yeah, 20, and again, that's kind of the same answer. 20 degrees. If you are seeing those signs, though, I would start to, think about coming back, or if you're out on a walk and we're starting to see that, knowing that you have to make it all the way back. But yes, 20 degrees is 20 degrees. Yeah. More winter questions.
How helpful is a little dog sweater?
I think they're quite helpful. Yeah, I think I was talking to Jen before. I like with the booties, there are some dogs that just will not wear those things. It's like a straitjacket when they go in. But I do think they're very helpful, especially for our dogs that have thin coats. I think it's a lot. We see them a lot more commonly than they used to, and I do think they help out a lot. Yeah. Yeah.
Is Paw it's advertised.
Patha, I have not come across that one. I'll have to look. I'm not sure. Yeah, I'm not sure. Agway has it. Yeah. Like I said, most of them are fairly similar in how they work, and usually, like I said, I've never encountered a toxic issue with them. So, yeah.
Question over here. Yes.
I was wondering if you have like specific qualities you're looking for in dog jackets to be more or less effective?
No, I wouldn't say, I mean, as far as like overall how much the animal it covers, like how thick it is, I don't have, I will say we don't really guide a whole lot on the jacket. We just don't get that question a lot. A lot of people just come in with them that they've, bought at the pet shop or online. But I don't have a specific measurements or like material that I can suggest. So. You're welcome. Yeah. All right. Anything else? Very good. You guys have to just let me know how I'm doing on time. Okay. I didn't rehearse the whole thing all the way through. I've got 2 young kids, so like portions of this rehearsed at once. So I didn't know if I'd be up here for 20 minutes or 2 hours. So we'll see.
I have a question.
Yes. Yeah.
It's not a safety question.
Sure.
I'm just curious. Why do you recommend front clipping harness?
Yeah, I think it gives better control. I think a harness with a back clip also works well. Yeah, again, it depends on the dog, but what we're mainly worried about is them taking off and dragging you with them on a slippery surface. But I think just in general, the harnesses work well. The back clip, the front clip, the gentle leads, I think those work great. And reduce the strain on the neck from your traditional collar. Yeah. Yes?
I think part of the theory with the front clip also is if the dog pulls,
Mm-hmm.
he tends to turn his head towards you.
Mm-hmm.
Or
Yep. All right. Very good. Any more?
at least that's what,
Some
that's
dog
what my
trainers
dog
here.
trainer says.
Perfect.
Active little dog, and usually she gets to run flat out every day, and I'm just sitting there wondering whether I could give him that exercise indoors, like how much of this, can you give a guideline?
I mean, it's this time of year is hard. I don't have like, the amount varies on the dog, I think. Yeah. Yeah. Yeah.
A lot of trainers who maybe Sin can back this up, is that mental activity for dogs exhausts them too.
Mm-hmm. Yeah, that's a good point.
And there are a couple of really, really good sites. There's one called Spirit Dog, and she has actually a great series of indoor things you can do with your dog that are really simple, but give them a little bit of exercise and uses their brain.
Mm-hmm.
And many times they use things you have in your house. You don't
Exactly.
need to buy these.
Yeah,
Yes.
that's a good point.
Running up and down the stairs.
Yeah. Yeah.
She could
Yeah.
heart attack.
Practice recall.
Mm-hmm.
Get a friend and have them go back and forth.
There's no work.
Nose work.
I'm going to put a plug in here, right here, because this will fit really well. We have, the Canine Club has already scheduled our next event, which will be on Centwork. And it's going to be at the Montpelier Rec Department. Because they only allow service dog here, so. And we have more room. And Ezra Haas is going to be running that. And we'll send out more information, but it's March 22nd, that's when we're going to do it. So just giving you the mud season things to do.
I was going to suggest dog-friendly places like Lowe's, Home Depot, Tractor Supply. Those are great places to take your dog and do some training. Let them sit, let give them a treat, have them lay down.
Lowe's,
Socializing too.
Yeah.
We also, if your dog has a problem with the scale when you come in for an exam, if you're driving by, stop in if we're open, come in, we do have the treats on the counter, weigh them. And then it's, it's like, ooh, I come in, I get a treat, and then we go home.
Yeah.
Sounds like weight loss.
All right. Is that it? Any more questions, winter stuff?
I just had one quick question.
Sure.
You were talking about frostbite and the
Yeah.
ears and everything. If a dog has gone out when it's like 0 degrees, that is no hair for a long time, can that cause an oral hematoma? I mean, could that?
Not like, yeah.
Capillaries, whatever, something.
Yeah, it's a good question. I suppose it could, but I'd be surprised. I mean, typically with those oral hematomas, it's more of like a scratch or something like, having dug at it or some sort of trauma. But yeah, I mean, I suppose. I've never seen a case where we've seen frostbite and then they get a hematoma. But if there's some level of irritation there and they've dug at the ear, absolutely.
It's hard
Yeah.
to figure out.
Yeah, right. It's not an easy like cause and relationship. But yeah, certainly. All right. So kind of the next part of the discussion, I thought we'd do a case-based thing for fun. James Harriet, I don't know if anybody watched the old BBC one. Love that one. I haven't watched the new one yet because I don't want it to ruin that one. But we have vet students that come and have never read the books or watched the movies. I'm like, how'd they let you into vet school if you haven't read this? Anyway, I digress. So Teddy's story. We have Teddy here, a 2.5-year-old male Cavalier King Charles. 3-day history of lameness and anorexia, so not eating, and an unknown vaccine history. So we do our physical exam, find some joint effusion, some joint swelling, uveitis, so some ocular changes going on there, and we're running a 103 temp. Oh, I was meant to ask you what to do next, but so next step after exam, we suggest some blood work, do some blood work here. Our hematocrit comes back at 35%, which is a little bit low. Our platelets are a little bit low. An increase in our creatinine, which is one of our kidney markers, an increase in total bilirubin. Get some urine. We look at the urine. We find some white blood cells in the urine, and that urine is a 1010 specific gravity, so dilute with respect to the creatinine. So we can summarize it as we're having an anemia, the low red blood cell count, a renal azotemia, being that the creatinine, we're seeing those high kidney values, and a low specific gravity, so we know something's going on with the kidney, and mild hyperbilirubinemia, which is that bilirubin that's increased, and thrombocytopenia, where our platelets are low. So our differential diagnosis list, and again, should have asked for questions on this one, but making our differential diagnosis, some things to think about, some things that we'll see in the area. The tick-borne disease is certainly something we see a lot of now, I guess starting from the bottom up. Anaplasmosis, we can certainly see a fever with it. We can see ocular changes with that as well. Some lameness there. We don't usually see the change in kidney values with that, but it's a good one to have on the list. A urinary tract infection, of course, we'll see some change with the urine, and we can see some change in the kidney values. We typically don't see that tied in with ocular issues, but nonetheless a good one to have on the list. Blastomycosis, which is a fungal disease. It's one of the fungal diseases we see in this area. Blasto can do a lot of things, cause a lot of issues in dogs. Whether that be musculoskeletal issues, respiratory issues. So something to have on the list. We don't usually see it causing issues with the kidneys, but again, with kind of a vague history, something good to have on there. Lyme as well. We can see Lyme doing a couple different things. Definitely, if we can see it affecting the kidneys, we don't see that one causing much ocular issue as well. But differential list. So. One last thing we don't have on there, leptospirosis. Leptospirosis is what this little puppy had. Next step after kind of formulating our differential diagnosis and thinking that lepto should be on the list, we'll go through more of the clinical signs and changes that will cause, but the diagnosis or the testing for it is called the MAT test, or microscopic agglutination test. So this is how we test for leptospirosis, and this little dog had positive titers for that at 6 weeks. We'll either see them have titers, increased titers right off, or we'll see those titers increase over time. Sometimes the acute infection will actually not have titers, but you don't need to remember that. It's just part. I just put that up there. Don't commit that to memory. Yeah, there'll be no test after. Yes, we'll go. We're going to go through it.
Do you have in-house blood, able to do blood work in-house?
Yes, yeah, and we actually do. We do have in-house leptospirosis testing as well. Most clinics do. That is not as sensitive or specific. So a lot of times we will run this test, but there is a kind of a quick test. A lot of times we will see that will do for really suspecting it, that sometimes can speed up treatment and whatnot. As far as treatments go, typically these with leptospirosis, we'll treat them with tetracyclines. Because oftentimes the kidneys are the issue, we'll do intravenous fluids, nutritional support. With these cases, early treatment is usually associated with best outcome for the acute disease. The treatment, and this is, we'll get more into this in a minute, but treatment does not always prevent chronic shedding, which is an important thing to remember with this disease. So leptospirosis is a bacteria. It is our most widespread zoonosis worldwide, zoonosis being something that can be transmitted to humans. It's a very motile, so gram-negative spirochete. And a spirochete is a class of bacteria that are these kind of small, thin bacteria that are motile. It survives in moist and warm environments for weeks to months, so it is something that can hang out in the environment for extended periods of time. It is killed by drying. A lot of detergents, acidic environments will kill it. There's at least 8 species of it with 200 serovirus, which are variations within those species. So it's a very kind of complex group with complex nomenclature. We'll see outbreaks of lepto tending to occur after a big rain or flooding in endemic areas, especially in areas with poor housing and poor sanitation conditions. In the United States, a lot of our cases, most of our cases we're going to see in the summer and fall, but the seasonality can vary with that. Worldwide, the most important reservoir are rodents. The brown rat is our the one that is most responsible for harboring it. With a worldwide prevalence of infection of like 30%, going up to 80% in some regions. So a lot of the is harbored in those guys. We can see leptospirosis in really all dogs of all ages, from our very small dogs that aren't spending a lot of time outside, because it is harbored, in rodents. We can see that, in urban areas being spread to small dogs that really don't spend a lot of time in outside ponds and puddles, like what is assumed, a lot of times with this disease. And then, of course, the dogs that have not been vaccinated for leptospirosis or inadequately vaccinated for it. Our cat friends, there's rare cases of it, rare reports of clinical cases, but we think they can act potentially as a reservoir host. So transmission for lepto, typically it is with contact with urine or water contaminated by urine. So that's touching open wounds or mucosal surfaces, or the intact skin if there's been exposure for long periods of time. Ingestion, inhalation as well. Inhalation, not definitely not the most common. It's usually these contact or ingestion. So again, with lepto, there is a bunch of these here, and they all will have kind of their species that they show up in, or that they're maintenance host. For dogs, that's the canicola. Again, you don't have to memorize this list, but just knowing that, I just put this up here to show you, the different species of lepto will show up in our different animals as maintenance hosts. So where it typically will cause disease is actually in the incidental host, which the incidental host would be anybody who's not the reservoir host. So it's in a species that is not typically the reservoir. That's when we're going to get typically our more severe disease, and the ones that are going to typically get the disease. They also are going to likely clear it more quickly. And an infection in those doesn't usually cause an endemic for the incidental hosts. What makes the bacteria troublesome and very effective is that they have a bunch of different weapons. They have endotoxins, which are toxins that they have in the cell wall that will cause damage once in the system. They have a lot of variation as well, so can hide in the immune system or hide from the immune system. They are motile as well, so they penetrate the mucosa and skin. And then they have hemolysin, which is a protein that's released by the bacteria that will kill red blood cells or cause the lysis of those red blood cells, and cellular toxic proteins as well. So what does it cause in dogs? And kind of back to our clinical case, in dogs we'll see it cause, usually we'll see it present as either hepatic or acute liver disease or acute renal disease. We can see it causing bleeding disorders, causing issues with our platelets. A lot of times these dogs are going to be spiking fevers, presenting with some sort of vasculitis or respiratory signs. And then again, back to our case, we can see it causing ocular issues as well. Petechia or ecchymosis is like bruising underneath the skin, patches of bleeding underneath the skin. So a pretty severe case of jaundice or an icteric dog with that really yellow skin, and that's from our liver damage there. So it's definitely something when we have a dog that's coming in that we've done blood work and testing for, pardon me, for having liver or kidney issues. This is usually always on our list. Okay. A little more information on that. Let's go back here. In our maintenance hosts, the infections do tend to last longer, persist for months to years. In those guys, a lot of times we aren't seeing clinical signs or absent clinical signs. mild clinical signs. They may be shedding the bacteria for a long period of time. That shedding can be intermittent and also be a source of environmental contamination where they're shedding it into the environment, typically through urine. As far as risks go, most of human cases are seen in Puerto Rico, followed by Hawaii. Just I think a very suitable environment for the bacteria. As far as like the folks that are most at risk as far as coming in contact, farmers, round animals, veterinarians, veterinary staff, sewer workers, zoo workers. People are spending a lot of time in water, swimmers, campers, triathletes, whatnot. They're outside and near water. So how to prevent it? This is one where we typically are going to recommend most vaccinate for this. It's either done. We vaccinate for leptospirosis annually. Every third year, for vaccinating for our normal distemper, that's usually in that vaccine. So it's something that we do every year. Initially, when we do it, we boost it a month, and then it's an annual vaccine after that. And this is one online, or there's a lot of bad press on the leptospirosis vaccine, and it's really one that, yes, of course, just like any vaccine, has the chance to cause a vaccine reaction. We certainly see those, absolutely, but it's not more than any other vaccine. So it's one that. We used to consider it a risk-based vaccine. Now we consider it more of a core vaccine, being that anybody can be exposed to this. As far as not really depending upon the lifestyle of the dog. More kind of prevention, just avoiding or preventing standing water. Minimizing the contact with rodents and wildlife, because those are, again, most of our reservoir hosts. If you do have an infected animal that's been diagnosed or whatnot, segregating that animal away from others, and then just really following good precautions as far as like cleaning up the urine, wearing gloves to clean up the urine. I have avoid contact between children and infected animals. Kids obviously more apt to have their hands in their mouth or be touching gross stuff and putting it in their mouth. So not just for leptospirosis, but any other disease that we're worried about. And then just disinfecting contaminated surfaces after removing the organic material, and of course vaccination. So just in summary, lepto prevalence varies by region. It also varies with seasonal conditions. Many common wildlife or domestic species are reservoirs for the pathogen, and it's transmitted usually via contact with urine or urine-contaminated materials, and a very important zoonosis. Questions on leptospirosis?
Do you see more lepto and blasto?
Oh, that's a good question. Lepto is, I would say, I would say we probably see more blasto now. I would say we see that. It's hard because we're now a lot better at diagnosing blasto than we used to be. Blastomycosis is a whole another hour-long chat because it can do so many things. My own dog had it, presented as her only clinical sign was she was collapsing, and it was a respiratory thing. But we'll see it go into bone. We can see it ocular issues. So I would say we see we probably see more cases of blastomycosis, but we also don't have a vaccine for it too. So, you know, a lot of our patients have been vaccinated for lepto and whatnot. But yeah, that's a blastomycosis is one I think we'll have more weapons against, you know, in the future. You know, already I think the testing is better for it than it used to be.
Expensive.
Oh yeah, yeah, yes.
You said there's 8 different species of lepto. The vaccine covers all of those?
No, the vaccine covers the 4 most common ones. So, but when it's tested for, more of those are tested. So they basically pick the ones that they're most likely to get. So it's not perfect, but it definitely is a good protection. But yes, there are more species than are in that vaccine. Yeah.
I was curious, you said Hawaii and Puerto Rico. In central Vermont, where do you see most? Is it from like particular?
I don't have the data to say, you know, where those, you know, yeah, it's typically around, you know, water sources that they're going to pick it up, but not. I don't have like a town or a neighborhood that, you know, yeah, yeah, exactly, yeah, yeah, yeah. Yes.
In that regard, is it limited to, say, stagnant ponds and bodies of water, or including spring-fed lakes, for example?
Yeah, you know, I don't think it's not limited, but I think the more flow you have, the better off. I think, you know, just the way it's collecting into those sources, you know, it's getting urinated out by a rodent or farm animal, something like that. So I think the more flow you have, the better, but it certainly can end up in those sources for sure, yeah. Yeah.
So we have about 5 minutes
Sure.
for you to look through this.
Yeah, yes, I can do that, like I said. This is the last thing I had, Lyme disease. We see, and I can just open it up to more questions because I know you guys are, most are well versed with Lyme, but you know, this is something that we see more. These are 2 CDC graphs, or charts rather, from 93 and then 2023, and just the cases. And this is human cases. This isn't dogs, but pretty. You know, you can connect the dots. You know, the more Lyme disease we see in humans, the more ticks that are going to get on the dogs. So, not just in New England and Northeast, but Midwest as well. You know, we were seeing more cases when I was going to school out in Indiana. They were getting more cases and whatnot. So we see a lot more ticks than we used to, and with that we see more of the tick-borne disease like anaplasmosis and Lyme. Again, transmitted by ticks, as you're well aware of. I'll skip through this because about a two-year life cycle typically, with the larvae and nymphs feeding primarily on mice. That's usually the reservoir. With the adults typically going on the white-tailed deer. And with Lyme, it will pass through the generation, so it will pass transovarally, so through into the egg, and then it will go from larvae to nymph, on through to adult. It usually takes about 24 to 48 hours for transmission to occur with a tick bite. A lot of these cases we don't see become clinical. So like, you know, we think about like 10% of these dogs become clinical. Most of this information is off of the consensus statement. So it's a board of panelists that make up the recommendations for the various diseases, and we mainly go off of that statement as far as our treatment for Lyme, our recommendations for Lyme. The big things with Lyme, with humans, not a human doctor, but you can see myocarditis, so issues with the heart, more eye issues, neurologic things. In dogs, typically on the acute infection, we're going to see more of the arthritis. So if they're clinical, we're seeing them present with a lameness. A lot of times it's a shifting lameness, so they'll oftentimes come in running a high fever. They're very lethargic. A lot of times they're not eating, and then the lameness starts out in one leg, and then all of a sudden we have effusion and issues in multiple. That's typically the bacterial infection when we see Lyme. I have Lyme nephritis here in red because that is honestly from the doctor standpoint, what we worry about more so than the arthritis component. The arthritis component usually improves very well with antibiotics. Lyme nephritis is more of a worry, and that's typically an immune complex issue between the immune system and the bacteria. Where it will form these immune complexes that will lodge in the kidney and cause a protein loss in the kidney. And that is, it's something that is really, there's not much you can do to reverse that process. So as far as a general public and knowledge, really, testing these guys, testing the dogs once a year with your annual vaccines for heartworm, but usually on that test we're also checking for anaplasma Lyme. So if they are positive for Lyme, not worried so much about the arthritis component, but more the kidney part is if they are positive, we're usually trying to check their urine for protein loss and really try and do something to help slow down that process. Lyme nephritis is not something we have a definitive diagnosis for. That's usually something that you would do as a post-mortem, but it's more of an assumed diagnosis if they're Lyme positive and we're having acute kidney issue. And I think that's probably all we have time for. Oh, just as far as control goes, doing tick checks, perimeter checks. The ticks like leaf litter, those knee-high grasses. And they will become active, over 40 degrees. I think we probably see them active before that, closer to freezing. That's why the year-round prevention is advocated. And we used to, when I was growing up and in practices and whatnot, we'd say, do the flea and tick stuff through November and then start back up in March, which now we just see them active. If we have a warm day, we'll see them active. So prevention. And the prevention is generally very safe and kills the ticks fast before they can transmit.
Is there a certain prevention that you recommend?
There's a lot of good ones now. This isosceline products, the NexGards, Credelio, those I think work very well. The Simparica also. There's a lot of research in that area, and the medicines are very good. So really, most clinics are gonna recommend a good one that's gonna kill fast, be safe. But the ones that we carry in our office are NexGard and Credelio.
Is there any of them that are not neurotoxin?
These, it's this class, the class that works. That is as far as the dog or yeah. I mean, it is something. If we have a dog with epilepsy, it's something we're cautious about. But oftentimes, and I've spoke with the neurologist about this. Oftentimes, even in a dog that's had seizures that is being managed for epilepsy, we're still keeping on these. We see very, very few issues with it, and it does a good job on the ticks. It works well.
They say it's not a neurotoxin.
I think we could still see, but big fan. I think it works very well if you're going to do. Well, it can't, I mean, it certainly can be. You can still see seizures with that. Yeah, and it's killing the ticks. You know, but I would say it does do a very, for a collar, that's usually the one we recommend. Yeah.
And is there a vaccine? Is there a Lyme vaccine?
Lyme vaccine, yes. Yep. So similar to the leptospirosis vaccine, we do a booster. We give one boosted at a month, and then it's an annual vaccine. And the vaccine, you know, works very well. We use it. It does not replace the tick control. We use it sort of boot and suspenders with that. But yes, you know, the vaccine is one. This Lyme, you know, is not considered a core vaccine, but it is definitely one, you know, based on the risk, and certainly now, you know, for dogs that are spending time outside in the grasses, even the lawn, it's a good one to think about. Yeah.
Do you recommend both the vaccine and the flea and tick?
Yes. Yeah. Do those. That's what we recommend to do together. Yeah. And our you know, control is quite good when we do that.
Do I understand you correctly that you're saying now you don't skip any months at all, it's 12 months?
Yeah. Mm-hmm. Yep. Are we out of time? That's fine.
Sorry,
Yeah.
that's it.
Yeah.
But one thing I want to let you know is that this presentation will be on the Montpelier Veterinary Hospital's website. So you can also actually go back and recheck those numbers and then Google them and then make sure he was right and then remember them.
Yeah.
And also we are very grateful for Dr. Julia for coming up. Rebecca has